Welcome to The Point. I'm your host, Eric Mitchell. Welcome back. We're back from our brief hiatus. Thank you very much for giving me the time as I had to deal with grief with the loss of my father. But we're back, and we're going to talk about a topic near and dear to my heart, and I hope yours also. The topic, mental health in America. Mental health is one of those topics that we don't talk about. As a veteran serving in the United States Marine Corps and having friends all across this country, mental health is something that veterans know all too well. But it goes largely ignored. PTSD, TBIs, and other things that are language that unfortunately most veterans know and deal with. If they don't have it, their friends sure do. Has now bled over to the U.S., where everybody's dealt with it. Whether it was COVID-19 in 2020 or 4 years under President Trump, mental health has spun out of control in our country.
There's a lot of people that are suffering now because of the economic conditions and because of the everyday strains of life.
If you had to estimate, what percentage of calls do you guys get that are mental health related?
I would say on average between 30 and 35%. You can trace back to a need or a diagnosis of a person that we're dealing with that has a mental health or substance abuse issue.
They're feelings so many kids are experiencing during these highly unusual times. 9-year-old Anderson Fields, one of an estimated 4.4 million children nationwide coping with anxiety amid the COVID-19 pandemic.
The coronavirus pandemic has not only taken a toll on our physical and financial well-beings, but it's had a huge impact on our mental health. And in minority communities where COVID-19 has hit the hardest, there is a long-standing taboo around mental illness concerns.
And if you're a male, it's even worse for you, because 9% of men experience depression on a daily basis. And get this, more than 3 million men struggle with anxiety daily. That's right. That's just men. We haven't hopped into everyone else. And I wanted to know why mental health is such an issue here in America.
Do you feel like it's your responsibility to make sure that the deputies are trained to respond to mental health crises like that?
That is our responsibility of our job, and that's part of the oath of office that we take, is to protect everyone. I do not control the checkbook, nor does any other police administrator. That has to come from your government to provide the necessary funds that allows you to have that expertise and training.
These are our veterans.
Harris County Jail in downtown Houston is the largest provider of mental health services in the state.
How's everybody? Good, good. Who are we? Stars and Stripes.
And I came up with some answers, so I'd like to share them with you.
I think mental illness has to continue to be conceptualized as an illness, as by definition something that is disruptive and painful and costs the individual a lot in their lives. I don't think you can say, well, creativity kind of has some saving grace over there. I do think there's a relationship. I think it's an important relationship. I think it has important ethical and clinical implications. But I still think illness is illness, and you have to study that, and that's the most important thing.
So why did we get here, and how did we get here, right? Well, I can explain it, and I'll use myself as the guinea pig. Because if we're going to talk about mental health, and we're going to talk about it in 2021, you need somebody who's dealing with it. Now, I, as you all well know, am dealing with grief. My father suddenly passed on January 4th, 2021. Wasn't expecting it. Man got up in the afternoon at 5:30 in the afternoon to make himself a cocktail. It's the last thing he ever did. How has that messed with me mentally? Oh, it's a hot mess. But it led me to these topics. And why? Why do we have this problem in America? It's what I call the Don Draper Effect.
Who is Don Draper?
The protagonist of Mad Men asks himself this question through all 7 seasons of the show. Don's inability to answer indicates the identity crisis at the heart of the story. It's highly symbolic that the man we know as Don is not actually Don Draper. Even his name is a lie. He was born Dick Whitman, but switched dog tags with a dead soldier in the Korean War to escape poverty.
What's your name?
Donald Draper.
See, we carry our emotions, and a lot of us do, not just men, but everyone. We carry these emotions deep down inside. And because we carry them in there, it's one of the largest reasons that leads to substance abuse. Now, I have not had an issue with substance abuse, but many of my friends, and Unfortunately enough, I'm blessed to be surrounded by many great American heroes that are veterans. Unfortunately, it leads to large substance abuse within the veteran community. But it's not just veterans. It's in law enforcement, first responders, and now healthcare workers after what they've had to deal with just in 2020 alone, dealing with the pandemic that is COVID-19. Now, this isn't a political episode, nor will it be. So let's stay focused here, because COVID could have been fixed a long time ago, but we chose not to. Now our first responders are our heroes, but this is leading to mental health. Add in the fact that so many people have lost family members to someone in COVID. We're almost at 500,000 people dead. That is a big number that we never thought we would get to. Remember, we were told by Easter 2020 this would be gone, but here we are. But let's stay on topic. A lot of us carry our mental anxiety and mental issues deep down inside. We're embarrassed to showcase them. I know as a male, and a lot of other people, I grew up watching sport, watching MJ dunk the ball, watching Jerry Rice score all those TDs from Joe Montana, watching those amazing home runs from Barry Bonds and the amazing Yankee squads of the late 80s, early 90s. And I never thought about the mental aspect about that, of sports and what it does to those guys. You never thought of that. When I watched movies like Full Metal Jacket and Platoon before I joined the Marine Corps, these are movies that I never thought of the mental aspect of that. There was never a moment watching Apocalypse Now that I was like tied together what Martin Sheen's character was doing, or Marlon Brando's character out of whack. Oh, he's psycho. Look at him playing that role. No, none of us tied that together because that's not how we're built. It's not how mental disorders have ever been talked about. Remember, most of America had no idea how military operations go down until a movie called We Are Soldiers, which showed an operation that it was successful, but lots of death, and showed how ill-prepared and what it was like to go through having someone come to your door, not a member of the military, but a taxi cab driver, to hand you a telegram and tell you your significant other died on the battlefield. That was the first time it's been in the last 2 decades where we've actually made mental health there. Whether it be the late James Gandolfini, the star of The Sopranos hit, as Tony Soprano, making documentaries on HBO, bringing together what PTSD is really like for our veterans and how it goes ignored. Law enforcement dealing with it, with a record high suicide rate in 2019 and 2020. Hopefully we can knock that down, but NYPD alone, the largest police department in the United States of America, suffered record high suicides.
New York City is experiencing as part of a nationwide trend in policing. Since January, there have been at least 125 officers who've died by suicide. According to one study, cops are 30% more likely to die by suicide than the general public. Police departments like the NYPD are expanding the safety net by offering more counseling and avenues for officers to seek help anonymously.
Suicides are on the climb in healthcare workers too.
And unsurprisingly, it's having a profound effect. In a new poll of healthcare workers who already faced high levels of exhaustion and post-traumatic stress, more than half who've cared for COVID-19 patients say their mental health has deteriorated since the pandemic began, with 22% saying it's gotten much worse, and it can affect even the strongest of people.
So we have to talk about this, but here's the problem. We don't think about the mental aspect of anything. When we think of sports, we think of the physical side. When we think of law enforcement, our military and first responders, we don't think of the mental side of that. But now, we're starting to. But we're lucky now because, like I said before, nobody talked about it. You never saw it in a movie. You never saw it anywhere. Remember Jeremy Renner in Hurt Locker when you saw that guy drinking whiskey and people are like, oh, that's so inappropriate. And listening to rage music. That was a mental disorder. And he was showcasing it. And a lot of us related to it. In the veteran community, a lot of people laughed. Outsiders saw it was amazing cinematography, amazing coverage, and really put you in the aspect of a warrior. What you saw was a mental disorder. But it wasn't the military sharing this. It took till athletes like Cleveland Cavalier small forward. He's actually not a small forward. Forward Kevin Love from Lake Oswego, Oregon. Kevin Love came forward and talked about his mental disorder.
What is the advice going forward? Is it something you need to address before it ever happens?
Yes, and it's different with each demographic, I feel like. But with young kids, I would just say that to speak your truth. Nothing haunts us like the things we don't say, and it's tough to be vulnerable, whether you're male or female. But so much of it is looked at as you're not strong, you are thought less of. It's scary to be vulnerable, like I mentioned. So it's a lot of the time is just speaking your truth and being. It makes you more evolved and feel stronger.
And now we're seeing LeBron James on the sidelines working on meditating and breathing drills, even while he's playing a game. Now we're talking about mental health. But we actually have famous people speaking out. Lady Gaga has come forward and talked about her mental disorders.
If I don't get another chance to say this, I just want to say I'm so proud to be a part of a movie that addresses mental health issues.
Mental anxieties that she deals with. And we even have politicians talking about mental health. While you may be watching this and going, well, thank God I don't deal with a mental disorder or any kind of mental issues. But just know this, in America alone, over 43 million Americans suffer from some sort of mental disorder. Most of those people, unfortunately, will never seek help. The numbers are extremely small. And our healthcare system does nothing to really help. And one of the first things that I wanted to do, and I think one of the first things we have to talk about is the first barrier. There's two that I see that cause over 43 million Americans to not even acknowledge that they have this disorder. And we unfortunately lose a lot of them, whether it be to substance abuse. Their families deal with it, which turns into domestic violence and craziness, or death or suicide. Things that none of us want to have to deal with, but we do. The first barrier is something important, and I'm telling you all, I suffered from it and now I don't. The first one is, can I talk about this? Who do I talk about this to? This is hard to do. A lot of us aren't raised that way. Military guys and gals that are out there, half the time you're just like, who can I tell this stuff to that's like, won't go snitch on me? It's legal to talk to that won't snitch on me. And two, like, I don't want to be judged. I don't want to be judged of the thoughts that go through my head. And this one is the hardest. I think people are just stubborn and they're like, pride and I don't want to do it. If you're a guy, you're like, I'm not going to do it. If you're a woman, you're like, I'm strong and empowered. I don't want to show weakness. Weakness, folks, weakness. Are we sure it's not pride? Our egos? What causes someone to not want to acknowledge that they may have something wrong? And you're not alone. You're not alone. How many great ones do we have to lose to mental disorders and suicide? Lincoln Park no longer exists because we lost Chester. Soundgarden. I can think of millions of people and veterans. Guys, we won't even glaze over that. And I'm not making this about vets, but we lose at least. And it depends on the numbers you look at. And I've seen some amazing number. Wes O'Donnell, who's appeared on To The Point, has shared amazing articles on this. But the numbers can either be anywhere from 22 a day to 60. That's right, ladies and gentlemen. 60 suicides a day in the veteran community. It's a big number. But vets make up 1% of our country. That's right, 25 million veterans in active duty. Boom, that's it. Ladies and gentlemen, that's the ball game. That's who we're talking about. That's 1%. But what about everybody else? We're talking about at least 43 million Americans have a mental disorder and don't even acknowledge it. But you're probably going, well, Eric, what's the second barrier? And that's easy. Healthcare. Healthcare has become a political issue because our lives have become political. We didn't want them to become political, but they have. And that's the fact of the matter. Our lives have become political. Could we go through 2020 and not have a discussion that didn't lead to the words Biden, Sanders, Clinton, or Trump? No, we couldn't. It was impossible. Family functions were destroyed. Conversations and social media filled the airwaves. We all have some sort of PTSD from November 3rd until January 20th. And we still see it today. The fighting continues online because we use the word unity, but we use it as a punchline, and it doesn't help our mental order. So I challenge you with this, is before I move on, I'm going to say this and I'm going to say it again at the end. We're going to talk about serving others because that's how unity happens. But let's talk again about the second barrier. One of the two barriers I see that are the reason why we have such mental issues in our country and why mental health is going to be the next pandemic. It's going to be worse. As we come out of a pandemic, we're going to walk into one that could be 100 times worse and really affect those closest to you or even you. That's this, that if you're trying to, and I know this from experience, if you're trying to access your health care for mental health help, they're going to screw you over. That's right, because you may be going, well, Eric, yeah. You're right, and there's a measure that protects us. Remember, we're supposed to have access to mental health care. Our country guarantees it, our insurance company. All the big ones say you could have it. And there's a 2008 Mental Health Parity and Addiction Equity Act, right? So again, two things that go basically hand in hand, an addiction and mental health. They're there. Whether it's an addiction to pills, whether it's addiction to drinking, porn, or whatever, it's an addiction. The Mental Health Parity and Addiction Act is still able to somehow be forgotten and not approved by healthcare providers. Our own insurance companies don't care. That's right. They look at mental health like nope, we're not going to do it. We have a right to tell you no, that you don't deserve it. You need to call your mental, and if you call them and tell them, hey, enforce this, do you know the number is over 95% pay for it? But you have to jump through the work. It's like they're not going to approve it at first. They make you jump through the hoop. You're already dealing with mental issues, and now you got to jump through the hoop. But I'm telling you from experience, and look at all the surveys, if you do anything out of this, make sure you jot it down. The 2008 Mental Health Parity and Addiction Equity Act. That is something that you need to know. If you're seeking mental health and you feel that you need it, you are to go do that. Go and look that bill up and call your insurance provider and throw that in their face. If you need more, and I'm going to make sure my team throws this up on the screen several times, I want you to go to parityregistry.org. That is brought to you by a Kennedy family member, probably the only Kennedy family member you don't know. But this organization was created to help with mental disorders and addiction because it is a huge problem in our country and it needs to be dealt with.
1 out of 4 Americans is directly affected by a mental health condition or addiction. That means you or someone you love has a diagnosable and treatable condition like anxiety, depression, or an eating disorder. Maybe you know someone seeking help for an addiction to alcohol or opiates. Mental health affects all of us. And like many, you probably rely on private insurance for your health care, including your mental health care. Getting the treatment for your condition can be difficult. It's not because you don't want to find a doctor and be treated. It's because when you do, insurance companies often deny your claims and leave you wondering why. It can be a mysterious and frustrating process for some, and even life-threatening for others. Has this happened to you or someone you know? You're not alone. It's happened to countless people from all over the country for many, many years, and it's time to put it to an end.
We've seen famous people, we've seen people we know, but the ones that hit you the hardest are the ESPN 30s on 30, growing up around Mike Tyson and the great Dennis Rodman. Watch the Dennis Rodman 30 on 30 and see what he's gone through. Remember in the 90s, we were like, Rodman's awesome. Look at him, he's dressing up in a wedding dress. He's so cool. He's dating Madonna. But does that really, what that was really when you go look back, was a cry for help. Dennis Rodman was drinking two-fisted, riding a Harley down this Vegas Strip in the middle of an NBA season and took 3 days off to go deal with this. He never sought mental help until afterwards, dealing with addiction, dealing with mental disorders. Look at Mike Tyson's fall from fame to where Mike is now. And then we go back and we'll close on this, folks. If you need mental help and you need somebody to outreach and it's immediate, please call the number that you actually can see right here on the screen. Mental health is no joking matter. That's why the show hasn't been a lot of humor in it, because our mental health is important, but it's up to you to speak out. So this message, as I close this show, is very simple. And this first, you'll understand, goes to my veterans. Vets, suck up your pride and get the help. Don't try to fight those demons on your own. You're not alone, and you know you're not. Pop smoke, and you know we'll come running to help you. You're never alone. You're never out of the fight. Everybody else, same message. You're never alone. You're never out of the fight. You can call people. You can message this show, and we will help you. We'll listen. There's people out there that will listen to you. Call Call your doctor. Get the check. It's good to talk to people. Get it off your chest. You can't do this alone. Mental health is no joke. Folks, we're surviving a pandemic, a crazy 4 years of a presidency, what probably is another crazy 4 years of it, in a world that we don't control and is growing as fast as humanly possible. Technology is booming, but there's ways. Meditation, working out, time blocking, taking your life back. We live in a remote world now where you can do more for yourself and still get your job done. The 9 to 5 days are basically gone for a majority of the world. So this is what we do. So I want to thank you guys so much. And remember to go check out parityregistry.org. If you have any questions, you want to learn more about the 2008 Mental Health Parity and Addiction Equity Act. I think it's important you go check that out. If you want to seek mental health, that's what you need to do. Again, I want to thank so many of you for your kind messages that you sent me during this last month that has been, oh my goodness, it's been unbearable. The entire Mitchell family thanks you guys so much for your kind words and support. To the point, we'll continue on. You'll see us once a week now. Check us out. Once a week, we will appear right here, same bad time, same bad channel. So you could check us out. Make sure you're sharing with your friends and following us on social media. I want to give a big shout out to everybody who supports our show. And of course, on behalf of the entire team at To The Point, I'm Eric Mitchell. Be safe, be strong, be smart, and God bless America.